again, I'm Greg Davis. I've been working with Kate this semester, and this is part of my leadership class, and I just have to do a quick presentation on the importance of quiet time in the hospital. So, why is quiet time important in the hospital? Research has shown that hospitals and other clinical settings are not conducive to sleep at all. It shows that sleep is an essential component of energy restoration and physical healing when recovering from illness. So many factors such as pain, noise, anxiety, lights, interruptions from healthcare providers can disrupt sleep. Noise has been found to produce damaging psychophysiologic effects, including hearing loss. That really wouldn't affect us in healthcare, but delayed healing, impaired immune function, increased blood pressure, heart rate, and stress. It's also a very common complaint on patient surveys after they leave an inpatient facility. And not to mention, it can also reduce the staff's stress levels, which we could all use. Patients that are interrupted have restless nights, are often too tired to do beneficial treatments the next day or during the daytime. For example, physical therapy, they might say, no, I'm too tired, or required ambulation, they might just use a bedpan instead of getting up to go to the bathroom because they're exhausted. Part of their pulmonary rehabilitation exercises also. Patients will often fall asleep during their meals instead of getting vital nutrition. That's a big thing. That's something that should be thought of as well. Lack of sleep will also cause increased confusion and agitation. And also to note that poor HCAHPS scores will affect hospitals' reimbursement, which is not good. So how can we help accomplish a quieter environment? We can close patients' doors if appropriate. You have to use your own nursing judgment on that if it is appropriate for your patient. Modifying any equipment that you can. For example, alarm settings on a telemetry monitor, try to keep the volumes down if you can. Some hospitals are enforcing a vibrate-only setting on their cell phones. Any little thing you can do to help makes a big difference. So you want to educate your staff on the importance, inform patients and families of our goal to help promote a quieter environment, and round on them prior to it beginning. So if your quiet time starts at 9 p.m., you want to go around and tell them that quiet time is starting, we're going to lower your TVs, or give out headphones for the patients so they can reduce the noise. So you could try to identify patients who do not need nighttime care. So if you don't need to get a set of vitals at 2 in the morning on a patient that's very stable, try to let them sleep. Those little things can make a big difference. Handing out earplugs can help dramatically reduce noise levels. One thing, some hospitals are investing in some ceiling tiles apparently that are noise absorbing and can help also. Let's see, you can minimize procedures and disruptions during quiet time. So if you don't need an x-ray at 9 p.m. or 10 p.m., if you could reschedule it to maybe the morning if it's not emergent, those little things can help. Try to restrict overhead paging to emergencies only. Dim the lights in the hallways and rooms. And again, I am aware that you guys already have a policy on quiet time, and it includes many of these things. It's just getting the staff on board is the tough part. Having a policy is fantastic, but actually putting it out there into the field it's up to interpretation whether or not how much it's being used and implemented. So let's see. So staff would have to regulate each other to keep their voice levels down, which is difficult on the night shift because that's their daytime and they come in and they talk in the halls with each other. But if we're just cognizant of that and just try to keep our levels down, it makes a huge difference. Regulate visiting hours and encouraging visitors to let their patients rest is a big thing because the patients feel like they need to entertain their guests instead of actually getting rest. And we can empower the patients to let us know if staff is being too noisy, which would be nice as well. So some other things we can do, lower phone volumes, close doors if appropriate, I already mentioned, and we can show staff specific complaints that people have put after they're discharged, and how many of them are complaining about noise levels in the facility. some obstacles to overcome. So we want to educate the ancillary staff as well. So housekeeping, supply staff, lab staff, everybody on board, not just the nurses and CNAs, and so that we're all on the same page together. Let's see. So again, the biggest important thing is for all the staff to buy into this. Not just talk about it and have a policy about it, but they need to try to believe it, or else they're not going to be motivated to actually do it. Because there tends to be a lack of awareness and understanding on this topic. So if we can work on those things, hopefully we can do better in this matter. So thank you for your time. I really appreciate it.
Thank you.
Thank you.